Welcome back, everyone, to the Invisible Podcast. I am your host, Dr. Ashton Wilson, and today I'm joined by a fabulous guest joining us all the way from back in time. In the USA, we've got Dr. Melissa Koehl, physical therapist, Pilates instructor extraordinaire, and hypermobility specialist. Welcome to the show, Melissa.
Thanks for having me, Ashton.
Thanks for being here and joining us back in time in Chicago.
Mhm.
It's Tuesday. For me, it's Wednesday.
Isn't that wild? Yeah.
It's always so funny when you try and work out what the time difference is actually going to look like in practice. And I love that when we were coordinating this chat, we really had to describe, well, what time of day is it for you right now while we're chatting? And then we'll work out a time that works around that.
I know.
So tell us, what have you been up to in the last couple of weeks?
Oh, wow. So last few weeks have been busy. I just went to the EDS conference, the Global Learning Conference in Dallas, which is it's an international conference. It's always great to connect with other people that specialize in hypermobility and related connective tissue disorders. And what's actually kind of cool is it's not just a provider conference, but patients come too, patients and caregivers. So it's this nice mix of getting to connect with other people that are not only passionate about treating and helping this population, but also the people that are living it day in and day out and are there to connect with providers that understand these conditions and hear their stories of what's been going on with them, or even things that are helping them that they want to share with the medical community and the researchers. So that was just last week and a half ago. I'm losing track of time. Um, yeah, so that's probably the biggest thing that's been going on. It was really, really hot there, but we were
I
inside,
know.
so I was okay.
I followed along on the Instagram, I think, and I really felt for everyone in the room when I think it was Lara Bloom had said how it was nearly, I don't know, like 100 degrees outside, and that's Fahrenheit for
Mhm.
us here in Australia. We work in Celsius, but in the US, it was just scorching outside, and that aircon was working overtime in the conference building. How grateful are we for aircon in times like that?
Oh my gosh, yeah. That thankfully, yeah, I stayed inside, but
So what were your biggest highlights of the conference? I'd love to know.
so yeah, there was a few that stood out. So I've been to a few of these, over the last few years. So after a while, you're like, okay, there's some things that get repeated, which is great especially for the people who are new. But a couple things that stood out that were new and interesting, was Dr. Claire Francomano. She's a, um, geneticist in Indiana. She's very well known in this whole community, and she gave the keynote speech, and it was incredibly validating because she talked a lot about POTS and orthostatic intolerance. So for if those are new terms to anyone, POTS is postural orthostatic tachycardia syndrome. So when you're upright, your autonomic nervous system is potentially dysregulated and your heart rate would go up, along with many other symptoms besides just that. But what's really interesting is some of the newer studies are showing that individuals with orthostatic intolerance, meaning they get a lot of symptoms when they're upright, but they don't necessarily have to meet the POTS criteria in order to have all of the symptoms associated with that come with POTS, like that mostly have to do with cerebral perfusion, so lack of blood flow to the head. So dizziness, brain fog, severe fatigue, blood pooling in the legs, um, GI issues, things like that. And it was great that she pointed this out because a lot of people I feel like are missing getting diagnosed because they don't quite reach the cutoff. Like they maybe get a tilt table test, which is the standard way of getting it tested. It's, you lay on a table and they slowly bring you upright over a matter of however long, take 20, 30 minutes. A lot of people describe that test as being incredibly uncomfortable, if not downright really horrific, the amount of symptoms they can get from that. So Dr. Claire Recomano was explaining how in practice, there's enough evidence to go based on people's symptoms and their history and the clinical exam findings, just looking at orthostatic vitals in the office is more than enough for her to diagnose orthostatic intolerance and begin to treat it. And without necessarily needing the tilt table test, not to say that there isn't a place for it, but many people really struggle with that or can't get it. And so when she said that out loud, like the whole room like erupted in applause. Everyone was like so thrilled to hear that, like on such a big scale, like a big stage and a big audience, to have someone that is that well respected be very clear that, look, we don't need to be doing that tilt table test for everybody. Like, let's just start. If someone has orthostatic intolerance, they have symptoms of it, I believe them, and then I just start treating it. So that was pretty like a special moment.
Yeah, I read that quote that I believe them and I treat it, and it hit me in the feels. I got emotional reading it. I can imagine being in the room and hearing those words. Like, I have such a crush on Dr. Claire. I am so much a fan of her work, and yeah, that would have been such a special moment to see. And yeah, you make really valid points there, what she's talking about. Yeah, we need to be better at believing the patients in front of us, and listening to them and what they're telling us,
Mhm.
because it's their story, and it's up to us to validate that experience that they're going through. So yeah, it sounds like it was a really great conference.
Mhm.
I mean, it takes me back to Canada last year where you and I met, which was just such a amazing experience for me, being on coming from Australia and meeting so many people from around the world. And there's something so special about these conferences because it's a room full of people who care about the same thing, and everyone is there to learn and everyone is there to connect. And it's so unique in that way. I've never
Mhm.
experienced a conference environment like it. I think that it's very unique in that way. So yeah, I can see why you keep going back.
Mhm. Yeah, I agree. And you meet so many people, you get to see like what's coming up new in the technology world, like different, vendors are there selling or just explaining what they have, which is that's always really great. There's a new product out there called that not affiliated with them at all, but it's this very simple product, like it's like a scarf for your shoulders called an arm V.
Yeah.
And it just goes, it's like a shrug, and then you put your arms in it. And if you have to sit for a long time and your arms are very loose and hypermobile and tend to sublux inferiorly like they do, it just gives you a little hug. I used it on the plane because just suddenly I felt like you were like how you kind of cuddle up with a blanket at night, where you would just kind of bring your arms up and feel cozy. And it was like so comfortable. It was great. I love this
It's
thing.
amazing. Yes.
Everyone was like walking around with their arm Vs. That
Yeah.
was fun.
That's so good. It's just filling a gap in the market, right? Understanding what
Mhm.
hypermobile people live with, and how we can make life easier. I think that's awesome.
Mhm.
That's so cool. Yeah, look,
Yeah.
I mean, I could talk to you all day about the conference, but we maybe we chat about that after. But today, what we
Sure.
are chatting about is strength training in the hypermobile body and symptom management using strength training. And I can't think of anyone more suited for this conversation than you. So tell us a little bit about your background, Mel. Tell us a bit about how you got into the type of training that you do as a physical therapist, and how you ended up working with the hypermobile population.
Oh, let's see. So I started this kind of training in general, like fitness. This goes back since I was a child, I suppose. Like it's a long history with fitness. So I was a gymnast when I was a kid. I started very young and worked my way up to a pretty high level in gymnastics. Like obviously being bendy and hypermobile made it that was a benefit. I did all the stuff like the foot, a lot of extreme back bending, like my foot on my head and like big over splits, and I did really well from that perspective because I would always get really like points, extra points, and my form was always great because my knees were never bent because they go so much more further than just straight. So it was so much easier to like get that kind of stuff. So that kind of solidified my fitness movement background. Like that was a huge part of my life. So I ended up eventually I had to quit because I had a stress fracture because of all in my lower back because of all of that extreme back bending. And that was very unfortunate. It was a tough time, like to like give that up. And um, it was really hard to find a replacement for it. Because even at that age, I had done gymnastics basically nonstop from like 4 to 14 years old. And I had lots of injuries, like more than the average person that I was in gymnastics with, but I didn't really think much of it, to be honest, because recovered. It wasn't like I, other than this last one. But then as soon as when I quit gymnastics, I definitely felt my body change dramatically. Like the amount of stability that I had from that started to go away really quickly. So even at a young age, I was like, I need to do something else. And I like asked my parents for free weights, and I would just like in my room as a teenager, just like do exercises that I remembered from calisthenics and things like that. As a gym, I'm like, I have to do something because I cannot, like everything's starting to hurt. So I just kind of made it up on my own as much as I can. And in college, I learned about weight training. Well, actually, in high school, I was really lucky. In high school, we had a weight training class
Oh, so
called
cool.
Bigger, Faster. Yeah, it was called Bigger, Faster, Stronger. It was like you could elect to do regular gym class, which was just like walk around the track or play volleyball. And that was the only two options we ever did, which I hated. I hate the volleyball. Like I can't hit the volleyball. My elbows would hurt. So I was like, oh, I'll do this. And we learned strength training, like basic principles of progressive overload, mostly using equipment, like gym equipment. And that was like, oh, okay, this is helping a ton. I get this. So then I just kept learning more about it through college and went to PT school and got certified in Pilates. As soon as I finished PT school, I did Pilates certification because I was missing like kind of more the bendy type of movements that I was from gymnastics. I wasn't getting that from strength training. So I wanted to do that, incorporate a little bit of yoga with all of that because I just kept searching for like, what's the perfect blend of things I need to keep my body from hurting all the time. It was just kind of figuring it out as best as I could on my own until I eventually started teaching Pilates. Right after I got certified in it, I had a class that I would teach in the PT gym that I was working at the University of Illinois at Chicago. I would teach a Pilates class, and I started sprinkling in other things as I was teaching that. I started sprinkling in yoga and strength training movements to it because I just was, as I was teaching it, I'm like, this needs a little something else besides what's in the classical Pilates mat routine. Um, and then I just continued doing like refining that over like 20 years of like, what are my favorite bits of all of these things? Um, and then I gave it a name. I called it Chimera Fit and started teaching it online.
Yeah, amazing. What a story. And I think, like so many people that I speak to on my podcast and that I connect with now, you know, there's always something lived that has led you to this passion. And, your own experience has created this space where you now share not only what you have learned, but what you have experienced as a practitioner and a person living in a hypermobile body. And you get to share that with people from all around the world because you do work online. Like, how cool is that? That's
Mhm.
amazing. Oh, so
It
good.
is, it's my favorite. It blows. I'm from back in the day, like the internet, it was new when I was in high school, college, right? So I didn't grow up with that. So the idea that you and I can even just talk from across the world, that you're in Australia right now, is still like it's old news to most people, but still to me, I'm like, wow, that's so cool.
It really is. And I think sometimes we take for granted how amazing our technology is, right? That can keep us all connected all around the world. It's pretty incredible. So tell us a little bit then, Mel, if we think about strength training as like I think of strength training as being integral for a hypermobile body because I look at it as we need more muscle to protect bendy joints. Muscle
Mhm.
protects our joints. That's how I look at it in a simplified form. Tell us and the listeners a little bit about why you feel that strength training has such a benefit for symptom management for a hypermobile body.
Well, I think it's like what you said for sure. That having strength it's a non-negotiable. It 100%. The more muscle mass and muscle strength that you have, the more stability you have of your joints. So we spend a lot of time with hypermobility talking about stability training, and there is a time and a place for some fine-tune motor control, activating your small muscles. Like there's definitely a need for that. But then we step away from those like kind of initial fundamentals, like the things that really get those stabilizers firing the most are stronger functional movements. So if you take, for example, like a squat and compare it to a bridge and see which one gets your multifidus, your deepest spinal stabilizer, firing at a higher amount. You look at an EMG study, like where they use electrodes in the muscles, which isn't comfortable. So thank you for subjects who volunteer to do those studies. Little needles in the muscles to see like what gets the highest amount of your MVC, your maximum voluntary contraction. Like those bigger strength movements are the ones that get a higher percentage of those stabilizers. So it's like just basic mechanics of like how the body works. So it's absolutely fundamental. And it's much more, what's the word, like economical? Like once you get to a point that you can tolerate doing some, what it looks like larger muscle group strength training, you don't necessarily have to spend hours and hours doing every single like small muscle group at one time. It's just for people with limited energy, which is a lot of hypermobile people with symptomatic hypermobility or struggling with fatigue. If you have an exercise list that's like 100 things long, it, to address every little muscle, it does tend to be very tiring versus a couple of like really key strength movements can be very economical and get a lot of things done at the same time without wiping out all of your energy for the rest of the day. So, so there's a lot of factors that, are super important. And your connective tissue too. It doesn't just strengthen your muscles, it strengthens your actual tendons and ligaments. Like we have pretty decent amount of research on that too. So it's very, very, very important. We have to go about it the right way because it does tend to get tricky if you just jump in and aren't aware of those smaller fine-tuned movements or your alignment or just that managing the load and recovery is a whole other thing because we can often feel fine while you're doing things, and then afterwards it gets a little dicey. So you have to
Yeah.
learn how to manage that.
Definitely you make some really, really great points there. And I think one of the things that two of the things that I see quite often in my patient base is one, they get told just go get stronger. And two,
Mm.
they don't know where to start.
Right.
So then where do you feel feel we go wrong with our communication on what is actually required? Because you made some really great points there with, understanding fine motor control and, potentially starting with small
Mhm.
movements, but then progressing to your more, I guess, functional movements. Do you think it's fear or do you think it's the unknown that holds people back on that journey? Like, what do you think?
For the people that I talk to most often, I don't know, it's so much fear. It's like they tried because they weren't afraid at first. They went ahead and tried, or they were an athlete in the past, or they are just jump into a fitness class or work with uh, somebody who may not be as familiar with these conditions. And then they end up with flares or with injuries because it wasn't tailored to their body. It wasn't truly meeting their body where they're at. Because so many of the patients I work with, they look young, healthy, like they don't appear to be at the level that they really are physically. Like they look like they can do more than their bodies can actually recover from. And in fact, they probably can do whatever the exercise that it is. Like they physically looks like it's good, looks like its form is good. You don't look like you're too tired in the moment, and maybe your form could be a little better, but it's not a big deal. Like for anyone non-bendy person, it would probably be okay to have your knee rotate in a little bit. Let's not like be too nitpicky with it. Your body will figure it out. But with the hypermobile population, where it's like that recovery is a little bit more challenging because of the changes in the immune system that we are like just starting to learn about, like these differences in immune activation and immune signaling. We see like changes with long COVID, and mast cell activation syndrome is so common in this community. There's something in the recovery, the breakdown of the tissue, and then the rebuilding of it that seems to potentially be more complicated. We see muscle soreness comes on more often with hypermobile individuals. There's some very not great research on that, but there's some. So like there's something about that recovery process that doesn't seem to happen quite as easily with a connective tissue disorder. And then it gets complicated because you're like not sure what you did wrong. You did a whole workout of like 10 exercises and you're like,
Mm.
I felt fine during that. But then the next day, or I was, fatigued for 3 days afterwards, or I was doing fine until week 4 of the program. And then suddenly everything is hurting. Like it's not just muscle soreness now. I'm just in a lot of pain. So
Yeah.
there's, yeah,
So what would be your
it's tricky.
strategy? Like, what would be your strategy working with someone? I know that you, so we spoke before the podcast about your program Ground Control, which really is, about getting people to start moving and learning how to move their bodies. But what would be your strategy for someone who is, maybe coaching with you or is doing some kind of training and that they're finding that their recovery is what's stopping them from progressing? What would be your strategy with that?
Yeah. So the first thing you have to learn is to not judge the workout by how you felt during it, but how you felt 48 hours afterwards. Because that's your true capacity. Because it often will feel like this was fine, but then you don't know what that next 48 hours is going to look like until it happens. So you have to like really get clinical about what that recovery time looks like. And we often have to just start at the very lowest possible amount, but what feels like legitimately too easy for you, and then see how you recover from it and then build from there. So you have to start with what feels, I will use a guideline of like 50% of like literally like 50% of what you think you can do. Unless someone's really and that's like that's just across the board. No more than 50% at first. Just because we just don't know what's going to happen. You can always do more. You can't do less. You can't like you overcook a steak. You can't undo that. So we're going to start with the least and then build from there. And if someone's really symptomatic or very much unknown about their tolerance, like I'll even go at like 20-30%. Like, let's just dip our toe in the water. It'll feel like you're doing nothing, but it tends to be faster, the progress, by starting that slow rather than completely blowing past what you can, blowing past it and then taking several days to recover or weeks to recover and then guessing again, like, oh, maybe that was too much. Let me dial it back a tiny bit. And that still was too much. And then you have to recover again. It doesn't work. So starting with like the very smallest amount at first, just to like really assess what your recovery is like. That's without getting into the nuances of like mechanically how to do it, which is a whole other thing. But just that framework of starting with the least seems to help a lot.
Mm. And I think what you're saying there as well is a lot about working out, how can we work with someone's individual capacity and how can we build their tolerance to activity? And everyone is so different. And that's why I love working in this space because there's no blueprint, because you have to be very creative and very tailored and unique in your approach with every individual. And I think that that's something that maybe gets missed in health and in fitness is this idea that, for everyone else, you just progressively overload and that will work.
Mm,
But I think it's a really unique population that we work with where progressive overload to a degree, but it's working within a threshold of what they can actually tolerate on their body.
yeah, 100%. Because there's these other factors, the dysautonomia that might be happening. So on certain days, their tolerance for upright, like that orthostatic intolerance we were talking about earlier, they might be fine one day or even for a couple weeks, and then suddenly, for a myriad of reasons, their tolerance for upright is just significantly less. They're trying to do squat or any other sitting or upright exercise and feeling very fatigued or dizzy, or just like the muscle capacity is just much lower. So if you're staying to the book, like, well, today's the day I'm supposed to increase my volume, I'm supposed to increase my weight. Like we have to be able to adjust that on the fly, or just move things to sitting or laying down. Like I've heard too many horror stories of people like working with people in the gym and being, oh, you're dizzy. Well, just go get some water and come back, and then we'll just get back to it. And like doesn't just it doesn't quite work like that. Or I know you're a little tired, but keep pushing through it.
Mm.
Um, it's not always the best thing. Like that also gets complicated because you don't want to like never push yourself or never challenge yourself. But for the people I work with, I feel like more of them are more prone to overly pushing themselves because I think we're so used to challenging. If you have a chronic illness and you're struggling with fatigue and not feeling well kind of all of the time, it kind of feels like you have to push yourself to just do everything in everyday life. So like why would exercise be any different? And or I used to be an athlete, so I'm used to like if I'm going to work out, I'm going to really work out. So the concept of like adjusting and doing less on days that you maybe feel like you can do less is very helpful, but it's much easier said than done. Because
Mm.
I think a lot of people are really prone to like, I want to get the most out of this. Let me challenge myself. If I'm going to do it, I might as well do it.
Oh yeah, I just had a
Yeah.
flashback of a client who I wrote a program for, and then I realized after 2 weeks that they were doing 2 programs per day. And I saw, like, can I ask why you did that? And then they said to me, oh, I just really wanted to get the most out of my time in the gym. And I said, like, I understand that, but you're now doing, instead of the 4 exercises I've prescribed, you're doing 8, which is double, which is probably going to
Yeah.
push you over capacity, which is probably why we're seeing in my office right now, 2 weeks after we started the program, going, you're not
Yeah.
feeling
Yeah.
all
Yeah.
that well. But yeah, it's interesting. I totally agree with you. It's the idea of actually slowing down, listening to your body, and not pushing beyond that threshold that allows for people to build more tolerance. Because if you push beyond it,
Mhm.
like I love that analogy of the overcooked steak, like a well done steak can never go back. And
Right.
once you go over the tolerance, like over your threshold, you can't just go back to that. You've got to now go through the recovery process. And I think that's
Hmm.
really interesting. 2 points on what you just mentioned there. I do want to touch on recovery, but how do you typically program for, let's say we're not at beginner level anymore. Let's say someone's done your ground control program and they've progressed through. Now they're in more of an intermediate level and they're looking to train maybe 3 to 4 times a week. How would you usually go about that and the programming of that, and how would you design that for that person?
So, like you said, it would be ideal if it's 100% personalized to that person, right? And there, what those exact exercises would look like would be a little bit different person to person. But speaking generally, what I feel like a lot of people do well with is an a workout that again, like that you mentioned, like 4 exercises, right? Like it as minimal as it needs to be to cover the whole body. So I tend to do like one lower body and one upper body exercise on the same workout. You know, instead of it being like a split, like all lower body, all upper body on a different day, which again, it's not wrong. People can do that. But I feel like when you have limited energy and limited capacity, we get like one big upper body, like let's say upper body push and a lower body hinge. There, we got one upper, one lower. So we're not like skipping body parts, skipping like big areas of the body, and we're not overloading anything too much. And then on another day, we get a upper body pull and a lower body squat. And then sprinkle in small muscle group things as tolerated to support that. But I really, especially at first, I make keep it as simple as possible with the functional strength training. Like I don't get super complicated with big diagonal patterns or fast movements, and like that's all great and I love that too. Like you want to like train your fascia and all the spiral line and oblique, you know, you want to do all that stuff. It's great. Plyometrics, like you want to like do all of this stuff, but if you're just learning, like just learning the very basic fundamental movement, squat, hinge, push, pull, like essentially I just focus on that and getting the form down with it, 'cause that's hard enough. If you have bad proprioception and you don't know how to find your neutral pelvis just sitting in a chair, it's a whole other thing to figure out, well, how do I do it while I squat? Or while I do a row? Like you have to like really break down those movements and not take for granted that how much stability work needs to happen for those simple, those simple movements. So just giving people enough time with those basics before like getting fancy, before doing things on one leg or multiple planes of movement and things like that.
Hmm. Yeah, I totally agree. I think that keeping it simple
Mhm.
is the best way because I always look at strength training as it's another skill that you're trying to learn. And so if you're learning a squat pattern, then we need to learn how to do that squat pattern first, and then we make it more challenging. So
Hmm.
I think that we can't dive headfirst into even things like, I think of like machine based stuff in the gym. I'll often have people tell me that, oh, yeah, I train in the gym and I do leg extensions and hamstring curls. And I think straight out, well, all of those are open chain exercises. Your feet are never on the ground. That's not really like setting you up for great success as a hypermobile person when your biggest issues are most likely proprioception when you're standing on two
Hmm.
feet. So it's just, I agree, it's finding what's going to work for that person, starting with the basics and then building upon that, and trying to get that bang for buck out of the time that they are dedicating to moving their body,
Hmm.
and really trying to maximize that without compromising on the recovery element, which is what I'd like to talk to you more about now. And I love, if anyone follows Mel on Instagram, you'll see all the time she's got lots of hacks and lots of tips for people that she's sharing on how to manage your like symptomatic pain and proprioceptive things. But what do you usually, in a general sense, encourage your clients to do to improve their chances of a better recovery?
So the first thing is what we've already been talking about is trying to stay within your energy envelope, your window of tolerance as best as you can. So that's always number one. A good warm up and cool down. I mean, this is very basic, but people skip it. They
Yep.
they skip it like a they be like, let's just get to the good stuff. Like a good warm up and a cool down is incredibly helpful. Um, and I even like to, for people who are up for it, like include in the cool down or in the warm up also too, but like we have to think of the nervous system too. So coming at the workout, either if you're in a very like hyper vigilant state, you're feeling very stressed or very, you know, like in a very sympathetic state even before you begin. I like to, pause and kind of recalibrate, tune into your body. That can look different for different people. It might be just sitting quietly for a moment with your eyes closed, or other people respond well to like move it, like kind of getting in their body and like doing a more dynamic movement to kind of regulate their system. I feel like that is really helpful for a lot of the people that I work with, rather than just sitting quietly and then we're going to go work out. They might do better with like a more dynamic, gentle, like just getting your brain to connect to your body in a really gentle way is like a warm up. And then finishing like with a actual cool down of your tissues, your muscles, your body, letting your heart rate come down, and really, really letting that be a full relaxation, like practicing shavasana style, like from yoga has been doing this forever. You get your body moving and you finish. Now that you've moved and gotten all of that lovely stimulation to your nervous system and hydration of your tissues and the lymphs moving and everything's great. And then that's the perfect time to kind of sit and settle and let things calm. And that seems to just feel really nice. So that kind of sets us up for success with that recovery, because you get like one practice of recovery right then and there, like with that workout. Um, Another thing that's super helpful is if anyone struggles with POTS, like where their heart rate is going up, or just any orthostatic intolerance, um, if they have a wearable to check their heart rate, I will ask them to let their heart rate come down below 100 between sets of exercises. Be like, this is a strength exercise. This is a strength workout. It's not a cardio workout. You want to give yourself that time to like let your heart rate come down, because that's where we run into the post-exertional malaise most often, is like this kind of extended heart rate elevated. A more cardio workout is more prone to trigger that in a lot of people. So like giving them permission, like you're not being lazy by sitting and resting between sets. Like you can, in fact, that'll probably help you feel like you're not completely trashed by this workout.
I love that because I prescribe 90 seconds to 2 minutes rest between
Yeah.
strength sets. And so often my clients will say to me, it's too long. It's too long. I'm sitting there for too long. And I always say, that I love that. What you just said, it hits the nail on the head because it's not about the now, it's about the future you. And having that rest allows your heart rate to come down, it allows your brain to process what did we just do and how can we get better at it. And it reduces that fatigue that we feel. But one of the things, and I'm guilty of it too, I'll put my hand up, I'm guilty of it, is it taking rest and then playing on my phone. And I'm like, that is the worst thing I could do because now I'm like stimulating my brain in a whole new way,
Yeah.
as opposed to
Yeah.
just
Yeah.
taking that rest time to really just focus on, okay, heart rate coming down, relaxing my nervous system, thinking about what did I just do and how can I do it better? I'm going to take that on myself, Mel. Thanks for that reminder.
Yeah. Yeah, it's easy to say and not to do. Like I have some one-on-one clients that like I sit there with them and I watch them like, okay, here we go. We're going to do the thing. And then I'll hit the timer. Here we go. About the same, like at least a minute. I'll tell them we'll do at least a minute and then maybe I'll distract them and start talking a little bit.
Yeah.
Make it sure we get to 2 minutes and then say, okay, now you can go. Because they need that accountability because otherwise your brain will find something else for you to do.
Yep.
Or just, yeah. Or you just get on your phone and then 10 minutes go by and you're like, oh, shoot. Now that was too long.
It's so true. It's so true.
Yeah.
But I love what you said there about the heart rate and allowing it to come down and acknowledging that a lot of people with symptomatic joint hypermobility may also have symptoms and signs of dysautonomia, and factoring that into the way that we train this type of population where I mean, I imagine it's pretty popular in the States as well, like group style fitness where people are going and the idea is to push, 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 and we do strength work, but then we combine it with, a superset of something else, and then we do some jumping jacks in between, and all of these things, and then people wonder why they feel so exhausted afterwards. But it's almost like, is that the feeling that you're supposed to get after training? And I would say no, but yeah, and especially for this population, because we are factoring in exactly like you said, dysautonomia and, potential like mast cell
Mm.
overactivity and fatigue and, post-exertional malaise, all of these things that we are constantly dealing with and the brain and the body are constantly trying to communicate to each other, work out what's going on. I think we need to shift our mindset around training for this population that you don't need to be busting your ass out there to feel like you're getting the benefit. And
Right.
I think
Right.
that's one of the things I've noticed with the way, and it sounds like you and I are very similar in the way that we coach and the way that we program rest, is that people feel like they're not working hard enough because they're not sweating or they're not gassed. But I think we need to
Mhm.
really like flip that narrative and go, no, this is about you and your needs and you building strength into your body to support your joints. But I wonder how we get that message out there to the fitness industry.
I know. It's complicated because some people do fine. My sister does. She doesn't have hypermobility. Yes. She does one of those types of classes and has for years. And it's like a combo of HIIT training and strength training. And I know lots of people, I mean, they're big chains for this for a reason because some people get results with that, which is great. And the thing about that you brought up about being tired or making you feel fatigued, like, yes, that's normal, but you should get better, right? Like if it was like as you first start doing it, it is normal for anyone new to exercise or do a thing that it would be tiring, of course. And that's not the problem with our hypermobile clients or us. Like it's not that it's tiring, it's just like it never gets better. Like you don't learn, your body doesn't recover, and it just always feels hard. And then people feel very frustrated, like something's wrong with them. Like, what am I doing wrong? Why am I every time I show up to this class, it kills me. Like, oh my gosh, I can't. The times I've tried like hot yoga, which now looking back, I'm like, that's the worst thing that I could possibly do. I have such terrible heat intolerance and I'm already stretchy enough. So I go in a hot room and stretch like crazy. And I would come home and feel like a, a burrito, like I was like cold on the outside, hot on the inside, sweating, everything hurts, exhausted, and then feeling like, why are people leaving this class and saying this is wonderful? I don't understand. And then you try it a couple more times. Like, well, maybe I just gotta get used to it. But it just like you get the same result over and over again. Whereas like of someone who doesn't struggle with those things, that has the appropriate recovery, that doesn't have dysautonomia, that they can regulate their body temperature appropriately. Like, isn't that lovely for them? But they do it, and then maybe it's a little hard at first, but then it gets easier because their bodies can recover and do well with it. And then
Hmm.
you're like stuck wondering, like, why? Maybe I'm just being too sensitive. Maybe they do feel this bad, and it's just me. Like people just don't think that there's another explanation because other people that don't struggle with this don't. They're just kind of they get through it so much with so much less problems. You
Hmm.
know? Yeah.
Yeah. Yep. I totally agree. And I think that that's, it's also something I think worth noting that for some people living with symptomatic joint hypermobility, maybe hEDS, maybe HSD, maybe something else connective tissue related, that it is possible to be able to train in that way. And for some people, they can. Some people love hot yoga, and some people love high intensity interval exercise, and it works for them. But it's about finding where is your level at right now, and what is going to
Hmm.
work for you, and what are your goals? Because for some people, they've done it their whole life and they're good at it. And for some, they've just started and they really enjoy it and they're not fatigued and they're not experiencing post-exertional malaise.
Hmm.
But for others, they are. And so it's just taking into account that we are all different. There is no blueprint. It's about working with what you're capable of and slowly progressing on that. And I think that that's a really important message for people to understand. But this has been such a great chat. I've got a few questions from my Instagram following that I'd love to send your way, Mel, but I'll just bring them up because I have them here on my phone. Okay, so first question.
Oh,
First,
sure.
first question, firing away. How will stretching affect hypermobility over time slash in the short term?
Mm. So there's a few ways to think about that. Like, because if you're hypermobile, you have a more than average range of motion, you can potentially continue to stretch more and gain even more hypermobility, right? Let's like athletes, dancers, gymnasts, right, can work on that. Um, there is some risk of overstretching your joint capsules and your ligaments at a certain point, right? If you're really going contortionists, maybe, right? Like there is a certain point, like if you really are kind of like aggressive or going for those extreme poses, that you're once you can stretch muscle tissue, which is basically more your nervous system. You're like training your nervous system to not react to the stretch as much, but you can start to stretch the tissues around the joint capsule, which can become permanent because we have something called tissue creep. So as you stretch the tissue, as you stretch it for a longer period of time, repetitively, it actually remodels in a longer position. Like if you've ever sprained an ankle, like you've overstretched those ligaments and now your ankle goes really far and you can't like get it to go back. So there's some risk of that for sure if you aren't very careful about how you do things. Um, and people hear that, and I'm always like, almost hesitant to be like, even explain that because then I'm worried that people will hear that and say, well, I'm hypermobile, I shouldn't stretch, which I don't think that's true either. I think you can stretch. We just potentially have to do it in a way that's safe and protective of your joint capsules and ligaments so that we're not creating that kind of more complex situation. So like keeping the stretching maybe to shorter periods of time or having muscle activation. That's my favorite way to do it, is just dynamic stretching so that you're actively using your muscles as you're elongating them. So then you're protecting your joints the whole time you're doing it. That can be really beneficial and safe and train your muscles to feel stable too.
Mhm.
Um, yeah,
I think another thing
that's my short answer on stretching. Yeah.
I think another thing I've seen on your Instagram, and I know I've talked a little bit about it in the past, but is actually using things like bolsters and pillows underneath your joints so that you're reducing how much end range you're experiencing when you are trying to stretch or I think that that's something that can be really helpful as well because a lot of people say stretching actually makes them feel better. So, okay, well,
Mhm.
doesn't mean we can't do it. It just means we need to do it in a way that is more safe for your bendy joints. So we're not just stretching joint capsules and remodeling, like you said. We're actually trying to target more the muscle tissue. So yeah, I think
Yeah.
stretching is always going to be one of those things that there's a lot of nuance with it as well.
Yeah, yeah. But that's a good point. The props, like in yoga class, most people would think they would only use the props if they were they're very stiff or they can't do the poses. But in fact, like if you can easily do a triangle pose, you probably should use a yoga block and not do the full instead. Maybe you should not go 100%. As a general rule of thumb, like if someone's first starting, I usually tell people stay within 50 to 75% of your range. Practice. Like, because that's hard. Our brain instantly wants to just go to end range because it's the easiest. You can just hang out there. It's harder to like stop at
Mhm,
neutral. So like as a starting point, give yourself the challenge of like, can you move less? And practice
mhm.
that and get that really well controlled before you start like really then diving into like, okay, how do I control my end range? Which you might need to do if you're a ballerina, you're a circus artist, like you have to learn how to do that. But it's that's the harder skill of that for sure.
Yeah, definitely a great tip there. You don't need to go to full
Mm.
end range. 50 to 75%.
Right.
The next question is, when I train in the gym, my knees always hurt. Any tips?
Oh, let's see.
Brutal.
Go back to everything we just said about load management and recovery. Go a little slower. Think about the number of sets and reps and how much rest you have in between. Um, I would look at your alignment for sure. It does matter. We don't have to like there is a space where sometimes a lot form and alignment can get so nitpicky that it terrifies people to move at all. There's a little bit of that, but also should look at it and see is it generally pretty good? Can you keep your knees forward without rotating them inward? Do you need support in your feet? Like if you have a very flexible foot, is your foot really overpronating a lot when you squat? Because that can change things up the chain. So that can be a game changer, just wearing shoes nice with a little bit of arch support if you need it. That can be a big game changer. Um, I love using a knee sleeve for support or knee taping, compression leggings, like extra support around the knee. Like there's, it's not restricting your range of motion. It's not stopping you from using your muscles in any way. So it's just giving you a little extra feedback from where you're at. Go less depth. Little baby squat still is a squat.
Mhm. Yeah, I think
Yeah.
that often, so I'll like just to add to that, I think often when we sense pain, we think of that area of pain as being the problem area. But
Mhm.
the way I like to look at it, and this is for this person who sent this question, and the way I like to look at areas of pain in the body, particularly when we're strength training, is maybe that isn't the problem area, but maybe that's the area working the hardest. And so instead
Mhm.
of instead of looking at the one working the hardest as the problem, let's look at what else isn't contributing. So I use an analogy of, if we've got 4 workers on a job site digging holes, but you've got one digging all the holes and you've got 3 standing around on their phone, who's going to be the grumpiest at the end of the day? It's the one digging all the holes. So maybe let's not go punishing the hole digger and blaming the knees, but maybe let's assess what else isn't contributing enough to these movements, meaning that the knee has to work harder. So, exactly like you said, we can look at what's the foot stability like. We can look at what's the hip function like. Do we need to adjust technique so that we can get more out of these other areas and take the pressure off the knee? But that would be my little take on that as well, just to add to what you already um, absolutely encompassed very well. But it's a yeah, it's definitely more of a complex answer than just here's the golden nugget that's going to fix the knee pain.
The one I know. Yeah, there's a lot of potential answers. But you're so right. The joints above and below are almost always a big player in any issue that we're dealing with. So yeah, sometimes there's obviously some direct things you need to do there, but taking care of the hip strength, stability, the foot alignment, all of that seems to help the knee a ton. So
Absolutely. Okay, and final question. There were a few good ones, but I've picked just the three that I thought were good discussion points for us. So apologies to everyone else who sent through questions.
Oh,
There were a lot of responses being like, "I love Melissa. She's amazing." So that was really
oh,
sweet. uh,
oh, that's nice.
yeah, but this question is, what's the best kind of exercise for a hypermobile person?
Well, the one that you'll do consistently, that's hands down the number one. Number one. Because if you don't do it, I could say strength training all day, like we've been talking about, and you're like, I absolutely hate it and I will not do it. Then it's not going to do you too much good. Although, other than whatever your favorite thing is, then I would say strength training is hands down like the biggest bang for your buck. And it can look like a lot of things. If people get intimidated, like I have to go work out with a barbell. Like you can, but you could be at home with bands as a starting point. You can do weight on the machines at the gym as a starting point. Whatever gets you going on that is one of the best things that we can do. It just has to be done appropriately. Um, Outside of that, I do love I like to have strength training as like my main course, and then Pilates and yoga as side dishes to kind of fill out the meal. Because all of them on their own have their pros and their benefits, and but are missing a little bit of anything. But if I had to stick with anything, it would just like if I don't do the strength training. If I don't do the strength training, or if people I work with are not doing strength training, they're missing the hugest part of the meal, the hugest part of the equation. The equation.
Yeah, couldn't have said it
Yeah.
better myself. I think absolutely whatever you'll stay consistent with is the one. But sometimes I look at strength training a little bit like brushing your teeth. You brush your teeth so you don't get cavities and you don't have to see the dentist every week. And you do strength training so your body doesn't fall apart. So sometimes some things just have to be done, but it is really, I absolutely agree. There's no perfect exercise for a hypermobile body. It's whatever you enjoy and whatever you're willing to do consistently. Consistency is the key. So that's amazing.
Totally.
So, Mel, as we start winding up towards the end of this really insightful conversation, I could talk strength with you all day. But what would be three key takeaways for our listeners today?
Three. Let's see. Thinking in the strength hypermobility realm that we've been in, I would say the biggest thing is to meet your body where it's at. And not just where it's at now, but where it's at over a couple of days after the thing that you do. So keeping that in mind that at that moment, your body most likely may not most likely, I don't want to set you up for failure, but it's very common for your body not to tell you what it really can do in the moment. Like we have to really think of it as that whole window and listen to where your body really is at. Um, Number one. Number two, start with then leave less than you think. Less than you think you can do. Leave at least 30 to 50% of your capacity at the end of as you're getting started. At least until you've well established what your capacity is and you know you can stay there. And then the third thing would be to be gentle with yourself. I know we just said that consistency is key, and I couldn't agree more, but you have to understand that your capacity and different days may be different. So even if you have all the best plans to hit the gym 3 or 4 times a week, like even if you get there once, it's fine. Even if you have to miss some time and all you do is roll around on the floor and do a little bit of something, like that's also something that still counts as being consistent. So we have to like be uh forgiving to ourselves and our energetic capacity and all because there's a lot to deal with symptomatic hypermobility. It's not just your joints, right? We have a whole connective tissue is in so many places of your body, and being able to manage that from your autonomic nervous system, your immune system, your GI tract, your genital tract, like there's your teeth are involved. Like there's so many other body systems that we have to think about that being as consistent as you possibly can with your exercise is important, but it doesn't have to be perfect to get the benefit.
Mm, beautiful. What a beautiful summary of what has been a great chat. And I'm sure the listeners will, yeah, take all of that on board. That's awesome. So, Mel, what is one life hack that has changed your life?
Ooh, one life hack that's changed my life. I guess I'll talk about it recently, just Because I struggle with the orthostatic intolerance myself, and that looks like my blood pressure drops when I'm upright for a long time or in the heat. And the thing, well, I'll say it's actually two things. One is getting really serious about compression. And I've talked about compression with my patients and everyone for years, and I was good about it. It was compression socks. But as things started to get a little bit worse, I had to add in abdominal compression to that. So, and that's what the research has shown too, like the full leg all the way up to your abdomen compression for orthostatic intolerance really truly does make a big difference. And the abdomen part of it, I just want to highlight how valuable that is, with the caveat that I understand it's not always the most comfortable, because depending on if you're sitting or you're going to eat, like you have to like figure it out like when you can do that, but it really does make a big difference for that. And bonus, like all that extra compression on pelvis, on knees, on legs, like for knee issues, for pelvis, SI joint, hip issues, like having that extra compression is really very, very beneficial and worthwhile figuring out how to sprinkle it in. Again, it doesn't have to be perfect because it can be hot. It can be, I get it. But something is better than nothing for that, for sure.
Sure. Big fan of compression. I think
Mhm.
I have a very similar story to you. I think I'm appreciating it more and more as I get older too.
Yeah.
Uh, what is one thing that you'd like to tell your younger self?
Mm, I think I would tell myself that I don't have to keep up with everyone else, and that needing to go at my own pace is not a failure or being lazy, or that I'm not trying hard enough. And in fact, maybe if I had given myself a little more grace to take my time with things when my body was giving me signs that I was doing too much or pushing too hard, that maybe I would have felt a lot better sooner rather than just kind of push through all of the symptoms and things that I was struggling with. Clearly, it would have been easier if I had alternatives of explanation about why that was happening. So I would probably tell myself that there is a condition called hypermobile EDS, because I didn't even know back then. um, but that with that, there are some special considerations for your body, and that it are things that you can manage, but it's much more beneficial to stay on top of it rather than to just ignore it and pretend like it's not happening and just push through all pain, fatigue, and things like that.
Hmm, that's really lovely. And what is one thing that you'd like to see change in the healthcare industry?
One thing. I mean, I wish everyone didn't have to worry about the financial aspect of it at all, ever. If I could change one thing, that would be the main thing, is the health insurance system is completely messed up pretty much everywhere, right? No one, unless you have a lot of money, can access everything that you would need. Such a stress on everybody, especially the chronic illness community. So that's the one. If there was one thing, that would be it. Is that we would have no need for people to worry about going bankrupt just because they have an illness.
Mm. And I think we're very well put when you look at the financial burden that comes out of like even the research that we know around hEDS
Mm.
and HSC, the financial burden, I think it was like 30,000 US dollars or
Yeah.
thing along that line, which is
Yeah.
just, an insane amount to have to spend on your
Yeah.
healthcare. And I mean, I know we own two very different systems. Like here in Australia, we do have a bit more, I guess, access through our Medicare system. And yeah, but I think worldwide things could improve and,
Mm.
across the board, I would love to see that too. Well, this has
Yeah. And
been, no, you go.
I was just going to add to that, like with complex chronic illness, the way that that's set up, it's just so challenging for providers to provide the care. And this too, like to provide the care that you would want to do, because they're limited in time that they get with patients, or the reimbursement is limited. So in order to work with people who have multiple system involvement in their bodies, it's really, really challenging to like do all that in a shorter amount of time, or to get coordination among the multiple providers that need to be involved, because there's no one person, right? You need your PT, you need your primary doctor, you need someone who's maybe an orthopedic and a neurologist and a GI and all of these things. And they're so siloed, and yeah, that part of it is also is also rough, and most of it comes down to ultimately the root cause of that comes down to the financial expectations of how we bill insurance and how institutions make money on their visits, because they have to just kind of turn and burn people through. It's
Mhm.
yeah,
Yeah,
it's a rough.
it is. It's, I think we are working towards a more collaborative healthcare system. I think that we are becoming more aware that, we need to step out of the silos and start working together. But I
Mm,
agree, there's so much more to go, and yeah, I would really like to see that financial burden lift from a lot
mhm,
of people living with chronic illness. Absolutely.
yeah.
But this has been an incredible conversation, and I think a lot of people, yeah, judging by how many messages I got of how many people love you, I think that the work you are doing,
Oh,
you are touching the hearts of people far and wide, and your impact in this space, I think, can't be underestimated. So thank you, Melissa Koehl, for being here today. And how can my followers and my listeners, how can they find you?
oh, wow. Well, thank you, Ashton. That's lovely. I'm like getting misty. That's so nice to hear. um, you all are sweet. Whoever sent those nice messages to Ashton, you guys are the best. And Ashton is the amazing. I'm just honored to be here for real. Let's see. To find me, I'm on Instagram is where I hang out most of the time at dr.melissa, KOEHL.pt. I have a YouTube channel also with some free resources there. I'm adding to it all the time. Um, I technically have a TikTok, but it's very inconsistent about me going on there. So we'll skip that. Instagram, YouTube, that's probably the easiest way to find me. Yeah.
Amazing. Amazing. Thank you so much, Dr. Melissa Koehl, for joining us today. And thank you to all the listeners for tuning in. If you do have any messages for myself or for Mel, please send them through. And if you have any suggestions on who you'd like me to chat to next, please send that through as well. But until next time, we'll see you then. Bye.
All right.
Yay.